Good afternoon, everyone. Welcome back to the AM stream on PB World. Thank you very much for joining us for this sponsored session by ThermaVein. I will be joined very shortly by Mr. Arturo Almeida, who is a cosmetic surgeon, and Heather Dorigo, who is Client Relationships Manager at ThermaVein. And the session is all about how ThermaVein can rejuvenate your business. So we have a presentation that we will kick off with in a second. I will jump back on at the end and answer any questions that any of you have.
Good afternoon. I'm Heather and welcome to ThermaVein's virtual studio. We're delighted to have with us today Senior Consultant Surgeon Dr. Almeida. Dr. Almeida has over 2 decades of experience running clinics, both here and in the UK and overseas, a well-known lecturer in aesthetic medicine, father of one, and a jolly nice guy. Welcome, Dr. Almeida.
Thank you very much, Heather. What a lovely introduction. I just love it. And I'm just delighted to be here again at the ThermaVein's virtual studio. It's been put together by Jodo Creative. And I noticed there have been some changes here and it's just fantastic. So, just, can I say, delighted.
This is our virtual home. We're loving it. Thanks to Yodo Creative. It's been fantastic.
Definitely, yeah.
Yes, during this COVID times.
Exactly.
So,
yeah, we are all concerned about this unprecedented time. Everybody's talking about unprecedented times, yeah?
Absolutely. So, Dr. Almeida, why should I rejuvenate my business now? Could you help us with that?
Absolutely. That's a great question because I think there's some things that I'd like to share with you for this reason. One, is true that we are currently living in exceptional times that put the entire world into lockdown. Obviously, the clinics had to shut down literally overnight, which means no cash flow into the business. And at the same time, some running expenses, overhead expenses that need to be paid during lockdown, which was not nice for business owners. And at the same time, and as a consequence of these, patients were sort of let down because they couldn't get their treatments done. And there will be some feelings of frustration, disappointment, unhappiness. And those are really things that we need to consider. Second, now we are on a different marketplace. And yes, it's a fearful market with lots of concerns about becoming infected by COVID. Clinic owners needed to adapt and implement new safety measures, policies to be COVID-19 compliant. And yes, we also live in a time of ever-changing rules and guidelines that create more uncertainty. But let me share this with you because my message today is this. I do believe that in an exceptional situation, we can develop unique opportunities. And if history has taught us something, is that growth happens normally during or immediately after a crisis, after world wars, the crisis of 2008. And I think that, believe it or not, this is a great time for our industry. And I expect a massive growth within the aesthetics industry because, believe it or not, patients want to look great. They want to feel great during these uncertain and unprecedented times. And it's a fact that we know, again, from history, that during crisis is when people want to look better, meaning that they're going to be begging to us for aesthetic treatments. So I really predict a massive growth in our industry. And I genuinely believe there's opportunities out there that we as business owners need to be aware of. So in my mind, there are 3 goals that we, the business owner, the clinic owner, must achieve during these times to rejuvenate the business. Number 1, obviously, to increase the cash flow into our business. We definitely need to do that to keep the business alive. Number 2, re-engage with our existing clients. Sometimes we are so worried about just attracting new people, but we forget about our already existing clients. And if somebody bought from us there is more likely that they get another treatment from us again.
Mhm.
And the third goal in my mind is just to attract new people to our clinics,
Yeah.
generate new leads, and convert these leads into new customers, new patients to our clinics.
Mhm. So, how can ThermaVein really help to rejuvenate my business?
Before going into that, I'm going to say, without talking about ThermaVein, how can I rejuvenate my business from a general point of view?
Okay.
And then I'll be happy to go into that.
Yes, that's a
I
good point,
I
actually.
feel that, there are 3 steps in my mind that you should go to rejuvenate your business.
Mhm.
Number 1, you need to stand out from your competitors. I think that we need to stop complaining and moaning about, the market out there. This is a situation out of our control. And instead, we should ask ourselves, what should I do so my patients will choose my clinic, my practice, instead of going elsewhere or maybe do nothing?
Mhm.
That's the main question that we need to ask ourselves. Okay, that's one thing. We need to create experiences, not just treatments. People just love to experience something. And at the same time, we need to have a plan, a strategy in the clinic. It's not just about turning up and then do treatments, because without a strategy, there is no business. So we need to focus also on our business and not just work in the business. That's step number 1, in my opinion. Step
Very
number
good
2,
point.
implement new experiences, new services. And in my mind, most of us, at least here in the UK, are mainly focused on derma fillers, toxins, and things like that.
Mhm.
But you need to do something else, to offer something else to your clientele, so you will stand out from your competitors, such as, for instance, face veins, nose veins.
Mhm.
I think those are great treatments to implement. Skin tags. Skin tags are
Yeah.
becoming really, really demanded.
Mhm.
And you don't need to be a surgeon to do a skin tag. I mean, they're easily diagnosed, and certain piece of equipment, as I just say in a minute, can allow you to do that in a safe and effective way.
Yeah.
Also, for instance, small words or milia. How
Yes.
frequently is found milia. That could
Yes.
be another option. These are, in my mind, easy treatments to implement into your practice, so you will increase the turnover in the clinic. Step number 3, I think that you need to invest in an equipment, but not any equipment. You need to invest in equipment that is clinically proven, backed up with the clinical data, that is medically compliant with FDA or medical CE. I think that's really key, particularly in the times that we're looking so much for safety. And it needs to have an outstanding after sales service, because sometimes you have the experience. I had the experience myself that I bought a piece of equipment and then that's it, it's over. No, you need to look for something that is reliable, but also there's going to have a lot of support and a quick return of your investment. So step 1, step 2, step 3, I think those are the key
Key.
things to rejuvenate your business.
Absolutely.
But you were asking us before, like,
Yes, I suppose buying ThermaVein, I mean,
Yeah.
obviously to have a new device coming into my clinic, how is that really going to give me that, return of investment
okay,
quickly? And, how is that going to be able to use that with other devices that perhaps I have?
okay. Yeah, I mean, I can share my experience as a ThermaVein owner myself since 2014. And, all I can say is, I was so blessed and happy to have loads of happy patients.
Brilliant.
But it's not just my experience. I mean, ThermaVein is now implemented in hundreds of clinics worldwide, and have, produced like tens of thousands of successful treatments. So it's not just my experience. But talking about my experience, it allowed me first to implement some treatments I wasn't able to offer at the beginning, like, for instance, cosmetic veins, as I said earlier. I generally believe that it's one of the safest, even for a dark skin, any skin phototype, which is great.
That's important.
Exactly. I mean, you don't have any limitations for the skin color. Effective and proven, clinical proven equipment to treat not just veins, ThermaVein, you can relate it to vein, but also other treatments such as skin tags, as I said earlier, small warts, vascular blemishes, for instance, telangiectasias are so common after the age of 40, which just almost barely my case.
They are. I've had a few of those, and they're not nice. You want to get rid of them. So
exactly.
if it's so simple and easy to treat, then why wouldn't you?
No local anesthesia, nothing, and it just disappears literally like that.
Amazing.
Okay, it's just amazing. So, but the other thing I like about ThermaVein is that it's quick to learn. You don't need to wait until you master the technique, but instead you can make money literally the same day of your training, which I think is brilliant. Okay.
Fantastic.
Also, a nice feature about ThermaVein is that it's a portable device, which means that if you are practicing in different clinics, as it's been my case for many, many years, you can take it from one place to another. It's just amazing. And it's a real portable device. It's not hassle. You take it, unplug it, plug it in, it's ready to go.
Yes. I have a few clinics that I've spoken to, and exactly that. They want to be able to take it from clinic to clinic. And with this, it's a small little suitcase.
Oh, absolutely.
So it's so easy to be able to do so. I love that.
And it has almost zero consumables, which means that you make your investment. It's a capital investment with no monthly contracts, no expensive consumables. So that means that once you pay off the equipment, it's all profit for your clinic. It's all profit for your business, which I think is a great feature.
And the treatments take a very short time too. So
I mean, actually, we're going to show a quick video, if that's okay, about nose vein treatment. And literally it takes about 15 minutes. Here's the video. Great, brilliant. That's a nose with red veins. That's the needle, the only consumable, less than a pound, British pound. I normally bend the needle so I can get better access to the veins. And as you can see, they disappear literally instantly. It's just a wow factor. And the treatment takes roughly 15 minutes. So in theory, you can make 4 sessions, 4 treatments in an hour, which is an amazing thing. I mean, you can just
so in theory, you could actually pay for the device in a couple of days.
Exactly. I mean, believe it or not, it's true. It's true. So it's just a great investment. At least it was for me. And last but not least, it's really important that the support that you guys have given me through all these years has been outstanding, awesome. It wasn't just for the technical things. It was just to questions about how to implement these treatments into my clinic, how to get better with it, how to just probably do the marketing. I remember once that you said, well, just let us know where's your Instagram, for instance, and we'll promote your Instagram. It's been great. So it's sort of a partnership. It's not just that you buy the equipment. At least that's been my experience, and I think there's been experience of many others. Am I right?
Yeah, it's so important to have that security of knowing that you've got that backup. But it's just so incredible. I mean, in order to do that treatment, to do the whole nose area, how long would that take? And
15 minutes, as I said, 15 minutes. It's just sometimes
crazy.
even less. And as you see, it's literally, it's no bleeding. It's a very clean, straightforward procedure, and with the minimum downtime.
Amazing.
Yeah, it's a great treatment. And the reason I can say that is because I've been using this, as I said, for 6 years already with no problems. Yeah. But I have a question for you, Heather, because during these unprecedented times, as we've been saying, as a practitioner, I may have some issues regarding safety. So can you share with me and also with the audience the measures that ThermaVein as a company has put in place to be, say, COVID-19 compliant or safe? Because that's important for me.
Yeah, absolutely. And I think, we've wanted to sort of make sure, the one thing is going back into clinics again, you still have that fear factor, as you were saying earlier.
Yeah, exactly.
So you want to feel you're walking into a clinic and straight away there's that sort of sense of security. So, we wanted to implement something that you can have that security when you walk in. So we have this TAC device, which basically kills everything airborne. So when
that's amazing.
Walk into the clinic, it's just fantastic to have this clean air, which is UV, very simple little device that would go onto the wall. And I think, you know, for us, we want to be able to, obviously it's an important factor that we take that side of the, you know, it's great to deliver treatments, but we want to make sure our clients feel comfortable to come in. So, you know, that's something I feel that they can, as a clinic, you can let your clients know that when they come into your clinic, that you've taken every safety measure possible.
Absolutely.
Also,
I mean,
during,
yes, it's true. I mean, for patients now, that is number one priority, number two, and number three. I mean, they want to feel safe.
Yes.
And so I'm so happy to hear that you guys have implemented all these measures. Anything else that you want?
Yes, and we've also got a face screen as well. So a protection
fantastic.
box, which is fantastic also, because then we can actually cover the treated area. You can see the little, here we've got an image to show, and it's great that you can pop your hands through to be able to deliver the treatment very, very safely. And obviously, you know, with using the visors and, you know, all our masks.
So you're protecting the patient and yourself. I mean, it's just brilliant.
Yeah, and it's just a perfect way to do so. So I was absolutely delighted we were able to bring that on board too. So yeah, it's fantastic. We're going through every safety measure that was possible. And again, because of this, we want to be able to deliver 7. We actually have 7 of these TAC-Air devices that 7 lucky viewers today will be able to have if they purchase one of our ThermaVein devices today. So one of the first 7 that are, you know, to come through with a demonstration will be letting you know on screen.
It's a shame that I couldn't be one of those 7 because I already have mine. So.
Yes, so yeah, which is fantastic. So they're going to be 7 of these as well. They're an incredible little device. But also, I'd like to show you a little bit more wow factor. We have a video which is just incredible of a lady called Kirsten. And I'd love to be able to share.
Please, thank you. Yeah, please.
That with everyone.
I've always had a small broken vein at the end of my nose. I've had it since I was about 3. As a child, I became quite self-conscious about it quite early on. As I became older and went to secondary school, I became more self-conscious about it. Oh my God, it's completely gone almost. You literally can't see it. You always used to be able to see like the little lines, the little shapes of it, and you can't see that anymore. Oh no, I feel that emotional. Don't stop it.
Wow.
I still go cold every time I watch that. It's just the most incredible video, and her reaction is amazing. And I'm sure you've seen this many times.
Oh yes, I can remember, you know, in a show that I was invited to speak, and we had different devices, and we used ThermaVein, and I treated this lady that had a similar lesion that needed to put makeup on every single day for years. When she noticed that the lesion literally disappeared, you know, instantly, she went into tears. So yeah, it's true. I mean, that wow effect is great. So
and it's life-changing.
Absolutely.
You know that you can actually just go without makeup and have that freedom, especially after so many years that you feel that you've got to cover up this blemish. So again, and so quickly.
Yeah, and there's one thing that I like to just to comment. I know I already talked about this. Is that ThermaVein, and this is one of the reasons why it's an equipment that you can make a quickly return of your investment, also known as ROI. That you can use ThermaVein to treat other you know, all the lesions or diseases. It makes sense. Yeah, exactly. So for instance, like, you know, as skin tags, I think skin tags are great treatment because with that you can just attract different customers to your business that eventually you can do some cross-selling to them, and then maybe they will engage with you into your patient's journey. That's something that you, by the way, you need to design. You can also treat small warts, particularly frequent in children, because you don't need to put any anesthesia, any local. It's just go, and then eventually goes away.
Amazing.
I already mentioned the telangiectasias and other vascular blemishes. For instance, you can treat sometimes small venous legs in the lips that sometimes you need to laser with local anesthesia. This can be done without any anesthesia. So all these other treatments can just offer you this quicker return of your investment. So I think this is a great feature that I wanted to share with you, Heather, and with everyone else.
Yeah, absolutely. And the other thing as well was eyelids. I wanted to mention that to you.
Oh yeah,
and
you're right.
Also intranasal.
Yeah, exactly.
Again, little treatments, which I was actually quite shocked that you can actually do all of that as well with the device.
Exactly. I mean, I used to use laser for these nasal vein, intranasal veins, and let me tell you, those are really painful. So you definitely need to numb them with local, which again was painful, very painful. With ThermaVein, you can do it with no infiltration, with no local anesthesia, and it's something that I wouldn't say is pain-free because it's not, but patients can take it without any numbing cream of local, which is great. Yeah,
that's fantastic.
Yes, fantastic.
Well, thank you so much, Dr. Almeida. I mean, we would absolutely love you to come and have a demonstration with us. They take literally 10 minutes, and it would be great to share the ThermaVein experience, a little demonstration with you. So please book, and we look forward to seeing you very soon. Thank you so much. It's been amazing.
Oh, you're welcome. I mean, as I said, I always enjoy when I come to this virtual studio. I mean, it's just great to just be here and to enjoy, you know, this. I've learned a lot here as well. So thank you very much. Thank you very much. So
now it's question and answer time.
Oh,
I love this section.
I can see that. Okay.
Questions and answers. So
we're now ready for taking some questions from the audience. I'm hoping to be able to answer most of them. And
I'm sure you'll be able to answer all of them. If you can't answer them, then no one can.
Absolutely.
Oh, thank you.
So, first off, I was just wondering how, and if you ever use ThermaVein in combination with any other treatments, like if you're treating someone for something that you perhaps approach with a few different modalities together, or as part with surgery involved as well. Like, how does it work with other modalities?
Well, that's a great question, Georgia, because actually, you know, during the presentation, there was some mention to red leg veins, and I didn't say anything about that because, as you properly said, in my opinion, and you know that I've been in vein practice for 18 or almost 20 years, ThermaVein is great to treat cosmetic leg veins when it's done in conjunction with a well-done sclerotherapy. So that's the best example that I can give you. You know, in order to achieve really good results with your cosmetic leg veins, you need to do both treatments in conjunction, so you then achieve great results. For instance, I can say, and this could be a bit tricky because obviously, say rosacea. Rosacea is a treatment that is very, very popular within our clinics. And the important thing about ThermaVein is that we don't treat rosacea. And let me be very clear with this, okay? Rosacea is a medical condition that is not easy to treat and need other treatments, you know, like could be chemical peels or could be many other things. ThermaVein is just brilliant to treat the visible vascular lesions that appears in rosacea. That could be another example. So, I mean, once you know your equipment and learn how to do it and then experience yourself, you'll be amazed the things that you can do with ThermaVein. I've been doing even, you know, like moles, and this is not a treatment for moles, but with experience and with the proper knowledge about these skin lesions, yeah, you can do that. So the possibilities are almost endless.
You also offer courses for microsclerotherapy.
Oh, that's true. I mean, it's true. I mean, that's a good reminder.
Yes.
Because I'm a vein surgeon for all these years. We are currently running. Actually, the next one is coming up in October. Am I right? In October, yes. We're running a course in sclerotherapy, microsclerotherapy for cosmetic purposes. You know, I'm not pretending anyone to become a vascular surgeon overnight. No, that should be wrong. But to treat cosmetic veins, cosmetic leg veins, combining ThermaVein and sclerotherapy is just a great way to go.
And can you just remind us what the qualifications are that someone needs to hold in order to purchase the ThermaVein device?
Well, ThermaVein is really easy to use, okay? So it's not a problem of, technical difficulty, but in my mind, because we are treating, patients with some vein conditions, I will say that ThermaVein should be used by medical professionals or under the supervision of a medical professional. That's my view of this.
Absolutely.
Yeah.
Yeah.
Mhm.
And from a company point of view as well, Heather, is that the kind of the message that you go out with, is that if someone was to inquire, you would rather that they would be using the device under medical supervision, even if they were, say, a level 4 qualified therapist?
Yes, absolutely. Again, it's a medical device. So, we want to make sure that, everything, again, as Dr. Almeida said earlier, we really pride ourselves on our service and, making sure that, when somebody does buy a ThermaVein device, that they have that security of knowing that they're delivering those treatments as they should. And, for us, that's ultimate, that getting results.
Yeah, yeah.
And they get full training on that as well. I mean, that's again imperative, and we really pride ourselves. The trainers are incredible. The knowledge gain is second to none.
Yeah, it's true. I mean,
It
I
is
really
so
enjoyed
true.
my own training.
It's amazing.
Years ago, I
yes.
was really impressed by the trainer.
I know.
Really impressed.
I did a training day, and it was, I have to say, it's 100%. You learn so much on rosacea. I mean, I've been in skincare for a long time, and I learned so much about rosacea. It was incredible. It really is.
It's true.
And just thinking with something like rosacea again, if someone was using ThermaVein as part of a kind of treatment program to, say, treat rosacea, are we looking, what if any downtime are we looking at after someone's had a ThermaVein treatment? I know that will probably depend on the lesion or on the vein that you're treating, but are people able to then have other treatments within a certain period of time, or should they lay off certain things afterwards if they're having a lot of treatments to treat something in one go?
Well, I think that's a great question, Georgia, because as I said, rosacea is a complex situation, and it needs to be treated within a plan, as you properly said. So in terms of the downtime, it also depends of how the rosacea is, showing the patient, or the treatments that that particular patient had before or is planning to have afterwards. So my approach for that is, first, you need to do a proper diagnosis, number one. Two, you need to set up a plan, a treatment plan. You cannot treat a rosacea patient exclusively with ThermaVein, and if it is not within a plan. That will be wrong, because then the results could be not the ones you're expecting, okay? And number three, in terms of the time gap, because there will be some downtime, and even that ThermaVein uses the technology called thermocoagulation, and normally downtime is not a long one, but because of the special situation of the skin, it could take a bit longer. So in my experience, my recommendation would be to wait at least 2 weeks. You check the patient again, and if everything is okay with the skin, you may consider to go ahead with other treatments. But I will give myself a 2-week safety time before consider any other treatments. But yeah, it's definitely a great tool to have within your toolbox. It's not just the tool, it's a great tool within this plan put together.
And that comes into what you were saying, doesn't it, as well, about knowing your equipment and knowing how to get the best out of it. Can often be using it in combination with other equipment, but it's knowing how to get the best results for you and for your patients.
Yeah, absolutely. I mean, when you have an equipment, you need to be a bit creative, if that makes sense.
Yeah.
You need to know the equipment really well and use it and test it. But once you've done that, just think outside the box and think, well, I mean, if I understand the technology, if I know what the technology can offer, for veins, for skin tags, or for other lesions, how can I do even more with my equipment? And don't limit yourself to what the company says. Follow the guidelines. Obviously, the guidelines are going to be set up for safety, but once you master the technique, just think outside the box. Just think. I mean, we, all of us, it's not just medical practitioners. Human beings are just designed to think, right? Not just to follow orders. So it's a great tool when you just think different ways to use it, and obviously you will get a quicker return of the investment, which has been my case.
Yeah, yeah. Okay, and then just finally, before we wrap up, is there any part of the body where you can't use ThermaVein?
Well, that's a good question.
Or where you perhaps shouldn't for safety precautions or whatever?
For instance, if you're aiming for veins, you should aim for red veins.
Mm-hmm.
I mean, I haven't had any issues with ThermaVein, even in the upper eyelid, which is, as you know, one of the thinnest areas of the, skin-wise in the body. You can treat some telasmas up here. I've done it several times, and even there, I'm not concerned about, going through the skin, even though it's so thin at that point. So I can't think of any particular area in the body that you can't use ThermaVein.
Mm-hmm.
But said so, it's also important to understand again how the equipment works. For instance, leg veins. If you're aiming to treat cosmetic leg veins exclusively with ThermaVein without understanding what's going on underneath the skin, it won't work.
Mm.
That's how it works. Like, for instance, you can see in this video how it works. We put the probe, and then the energy is delivered through the needle, and the vessel is sealed instantly. We don't use the melanin as, for instance, lasers do. We just seal the wall of the vein, okay? So it works great. But if you're treating cosmetic veins, you first need to understand what's going on that affects the surface. From the patient's perspective, it's just what happens in the surface. You come to my clinic and you want to get rid of those, unsightly veins that you have in your legs so you can look even more wonderful, okay? But if you don't understand what's going on underneath, and maybe you have other dilated veins under the skin that are not treated, and for that, sclerotherapy is the best tool available, then you won't be successful. So in your patient's mind, and maybe in the practitioner's mind, say, well, ThermaVein doesn't work. No, ThermaVein does work. What it didn't work is the understanding of what's going on in that particular vein. So that would be my advice. Similarly with rosacea, it works really good with rosacea when it's properly used. That will be the limitation, in my opinion.
Brilliant. Well, I think we're going to have to wrap up, but that was a fantastic presentation and definitely the most snazzy technological one we've had. So other brands might get inspired to do something similar because it looks brilliant, really engaging.
Yeah, absolutely. And again, we would like to thank Yodo so much, Yodo Creative, because it is incredible. Lockdown, I don't know what we would have done, because it literally, it's given us the opportunity to still be able to see all our clients globally. So it's been incredible. So big thank you to Dr. Almeida again.
Oh, you're welcome.
As usual.
Yeah, thank you so much, Arturo.
It would be okay to invite maybe, companies and other people to explore, to use this virtual studio and to enjoy, what Yodo Creative has put for ThermaVein.
Absolutely, absolutely. Very, very happy to.
Oh, lovely, thank you. And so we can see contact details on the screen at the moment if anyone did want to get in touch. Oh yeah, there we go, that's easier. And yeah, thank you both again very much. And Arturo, I'm sure we'll be speaking to you soon to pick your brains about something else.
I think we have another date, aren't we?
Yeah, we do, tomorrow.
Have another tomorrow.
I remembered actually. So yeah, we will be back. So we have one more session today on the AM stream, and then tomorrow is our medic only day. So Arturo will be joining us again then, and we will have some brilliant sessions tomorrow for our clinical medical viewers. So Heather, thank you very much. And thank you very much to the team at ThermaVein. And we will see everyone 7 p.m. today and then all day tomorrow for the last day and medic only day. Thanks very much, guys.
Thank you.
Bye.